Hello, everybody. I'm Professor David Adams. I'm head of the College of Medical and Dental Sciences at the University of Birmingham and director of Birmingham Health Partners, which is our NHS university partnership focused on delivering research into the NHS across the city of Birmingham. So I thought it was worth saying a few words at the end of what has been probably the most extraordinary and difficult academic year that any of us have lived through. We have had to make remarkable changes as a university and indeed as a sector to cope with the demands on teaching and educating our students, and in addition to mobilize the facilities and capabilities that we have to help the national response to the COVID pandemic. So in Birmingham, we were very quickly off the mark in several areas. Testing was one of the first areas that we became involved in, and we mobilized our capabilities and our expertise to set up regional testing centres within the university and help to roll these out across the region, and indeed helped actually to develop new approaches to testing and some of the research around the effectiveness of testing. And this has been really important, not only in delivering testing to our communities, but in assessing the effectiveness and how best to use these technologies to make society a safer place. In addition, several of our clinical academics have worked with colleagues nationally and internationally to define how we can continue safe clinical practice in the face of a pandemic. So with PregCove, we've been looking at aspects of maternal health and pregnancy during the pandemic and the effects of the virus on pregnancy. With COVID Surge, this is an initiative led from Birmingham, but with partners across not only the UK, but across the world, looking at how we can safely operate on patients who are infected with the virus and how we can make our surgical interventions as safe as possible in the context of a pandemic. And then again, working with partners across the UK, we've helped to drive forward the UK coronavirus monitoring project for cancer patients, defining who it is safe to treat, who has susceptibility to the virus, and how we can best mitigate the effects of the pandemic on delivering cancer care. So all of these have been really important initiatives in contributing to the national agenda. And one of the things that has struck me most over the last 12 to 16 months is how the UK universities, our NHS partners, and indeed industry partners have really come together to mobilize the capabilities that we have as a sector to address this terrible disease. And this includes the development of new treatments, as well as the diagnostics that I've mentioned already. And it includes work that has been led by Birmingham, but again in collaboration with many partners across the country, to understand the immune response to the virus, to understand how the vaccines are working, and how we can begin to safely learn to live with this infection. But in addition to all of the work that's been going on related to COVID, we have continued to do our non-COVID research. And we've had several major successes over the years, culminating in one of the largest industry grants that we've been awarded in Birmingham, a £22 million grant from Bayer to investigate childhood cancer, particularly a cancer called rhabdomyosarcoma, with novel approaches and clinical trials to help deliver the first effective treatment for this devastating disease to children. In addition, we've had an exciting program of work into traumatic brain injury, which has resulted in us contributing to new ways of testing for concussion and trauma in contact sports. And this has been highly topical, of course, during the recent Euro football finals, but we're also working closely with the rugby union and others to see if some of the tests that are being developed can be used to give rapid readouts on concussion in the sporting context. So in addition to research activity, we've also had to really rethink the way that we deliver our educational programs to our students, including, of course, the extensive number of health programs that we have within the college. And I have been remarkably impressed at how rapidly, not just our college, but the university across the board, and indeed the higher education sector nationally, has learned to implement new ways of working so quickly and so effectively. And this is certainly something that we need to take forward in the future to help us deliver our education in a more innovative and digitally focused way. So as we come to the end of this academic year, we should also be looking forward to the future. And there are several things in the health arena that have really been highlighted by the pandemic. That is the devastating consequences of health inequalities, of urban deprivation, and of multimorbidity, and the importance in a really strong and vibrant public health sector and strong and vibrant partnerships between academics, our colleagues within the NHS industry, and indeed government, in putting in place the kind of expertise to help us address these issues going forward. And we in Birmingham are very much looking forward to the challenge in the future of working with our partners across the city, and indeed partners nationally and internationally, to help address some of these fundamental problems and questions. One of the elements that we are designing and delivering that we think will help us work across these sectors to address some of these issues is the Birmingham Health Innovation Campus. This is an area of ground which has been developed on the edge of the university campus, close to our main NHS hospital partner, the Queen Elizabeth Hospital. And we're developing this in partnership with Bruntwood SciTech as an innovation campus where academic expertise can underpin collaborations with patients, clinicians, and industry to help us bring together the expertise that we have on the campus to address major health issues. We are expecting the campus to be open in the next couple of years, and we are really looking forward to this being a vibrant and really interesting, innovative cross-sector collaboration that can help drive some of the ideas that we generate in the university through into adoption within the NHS and across the broader community. And also, of course, at the same time, help to drive the local economy in Birmingham. So we've had a really difficult year, but we have been able to continue delivering outstanding education and really exciting research. And we're looking forward to the future with real optimism that we can learn from the past 12 months and take some of those lessons into the future to help us really have impact in what we do to improve the lives of our local and national populations in the future. So thank you all for watching this video, and I hope that you all get some downtime over the summer. We are long overdue a recharge and a reset, and I think getting time away over the summer is really important so that we can come back in the next academic year ready for the challenges that will face us.